Well, today, as you know, the Northern Ohio Trauma System, NOTS, was formed in 2010. And it was formed with the purpose of providing emergency trauma care in a way that would be effective, efficient, and ultimate measure is whether or not it would save the lives of people. And since it was formed, it's done a pretty good job. With the entry of University Hospital into the organization, I believe it will take it to another level. And so I want to thank University Hospitals, Cleveland Clinic, Metro Health for their collaboration and their partnership, because what they've demonstrated, even though they're in a very competitive world and environment, they're willing to work together for the interests of serving people, and particularly in this case, people who would be in immediate need of health care, and that's trauma. So I will introduce Dr. Wiley, who will continue the presentation. Doctor.
Thank you, Mayor, and thanks everybody for coming today. So it's a pleasure to represent the Cleveland Clinic today, along with my partners from University Hospital and Metro Health. This is really a continuation of something that the Mayor's office asked us to start a few years ago. So a couple of years ago, you remember a little scare called Ebola. And we needed to generate a community response among all the hospitals within Cleveland and Cuyahoga County. We had many, many meetings, hundreds of hours were spent. We built units in our own hospitals for respiratory diseases and for other highly contagious diseases. Those, for the most part, are still here and still available to the community if we ever need them. But fortunately, we never had an Ebola patient. 1 year ago, we got together as an extension of that, and the Mayor's office started to talk about diversion in our emergency departments. And so in February of last year, the three systems agreed that we would adopt a no diversion policy, and that means that we wouldn't tell the squads not to bring a patient in because we were too busy. And the reason for that was to provide optimal care for the patients. That is, if you'd been getting your care at Cleveland Clinic, at University or Metro, and the squad took you there, we should be able to provide your care and not transfer you to another institution which didn't have your medical records nor the experience of taking care of you. And then finally, the RNC. After hundreds of hours of preparation, the RNC came. The police force and the law enforcement in Cleveland did a terrific job, but we were prepared for mass casualties. And all of us prepared together, and once again, many, many hours of collaborative work. And this is the next extension of that collaborative work, so we're announcing a new organization. It's still going to keep the acronym NOTS, Northern Ohio Trauma System, and we're going to combine policies and procedures, and we're going to look at outcomes, and we'll evaluate best practices and share those among each other. So with that, I'd like to introduce Dr. Bill Annable from University Hospital.
Thank you, Rob. Good afternoon, everyone. I'd like to begin by extending my thanks on behalf of the entire University Hospital community to Mayor Jackson and my counterparts at Cleveland Clinic and Metro Health. We are pleased to collaborate with Metro Health and Cleveland Clinic in this newly launched NOTS to enhance trauma service coordination throughout Northeast Ohio. This joint success is a showcase for the ways that we can work together on behalf of a healthier and safer region that we all call home. Across the country, trauma is the #1 cause of death for people from ages 1 to 44, and that's a big challenge. This new trauma network is intending to take on that challenge. Together, our members are dedicated to saving lives by getting patients to the care they need as rapidly as possible. Cleveland's health systems have a track record of coming together on important initiatives, coordinated care during the RNC, our rapid response to the threat of Ebola, and our commitment to addressing the opioid and addiction epidemic in Northeast Ohio. This trauma collaboration is another example of our collective commitment to the betterment of our community. Since we launched a Level 1 trauma unit in late 2015, we have cared for more than 2,000 patients. Our program, led by Dr. Glenn Tinkoff, joins with our longtime pediatric Level 1 program, Dr. Mike Dingledine, and our division chief, Dr. Nathaniel McQuay. We at UH are commemorating our 150th anniversary of service to Cleveland, Northeast Ohio. This collaboration is one more way in which we show that we remain committed to this community which has supported us for so long. And now I'd like to introduce Dr. Bernard Bullinger, J. of Metro Health.
Hey, good afternoon. On behalf of the Metro Health System, I'd like to thank Mayor Jackson and the Mayor's Office for hosting this announcement for this, really landmark agreement. I'd also like to recognize the leadership of Dr. Bob Wiley as the current chairman of NOTS, leading us to this point in the process. Thank you, Bob. And of course, to our colleagues at University Hospital. This is certainly a special day for Cleveland and for Northern Ohio. The shared commitment to improve the outcomes of trauma victims was the driving force that led us to expand NOTS. We are all here because at the end of the day, this is all about saving lives, as you well know. The inclusion of additional trauma centers into NOTS, that is expanding the geographic reach of NOTS and the scale of NOTS, will help ensure that more people receive the care that they need at that crucial time in their lives. This is really a great Cleveland story. This is a story of 3 health systems working together and collaborating, and coming together in this collaboration for the betterment of the people of Cleveland and of Northern Ohio. We know that this collaboration will improve the health of our community. The Metro Health System is very happy to be here with you all here today to share this great news. Thank you very much.
Good afternoon. I just want to echo what everybody has pretty much said already. I really want to underscore the importance of this collaboration.
Why don't you tell them your position so they know?
Okay, for those of you that don't know me, my name is Ed Eckhart. I'm the Assistant Director of Public Safety for the City of Cleveland. My responsibilities are to oversee the divisions of fire and EMS. And medical care is near and dear to me. I was the former commissioner of EMS for 11 years, and I grew up as a paramedic in the community. So when we talk about this collaboration today, it really is something that's very special. It shows that in a very competitive environment, all of the healthcare providers in our community are able to set that aside and put patient wellness, patient outcomes, and the best interest of our community first. It's difficult to do that when reimbursements through things like Medicaid, Medicare, and third-party insurers are shrinking, when the healthcare landscape is changing, to say the least. Being able to step forward under the leadership of the gentleman that spoke before me is something that Cleveland should be very proud of. The doctors talked about Ebola and talked about the RNC, but really it's so much more than that. Their ability to understand what first responders need and the assistance that's required for that seamless care of delivery is something very important. And a lot of this collaboration came from our first responders in the community saying to the healthcare leaders, we need help, we need you to put together a common protocol, a common platform, so when we're on scene, we don't have to worry about what protocol do we need to follow for University Hospital, Metro Health, Cleveland Clinic. This allows everybody to work under and within one seamless protocol, all focused at patients' outcome and in their best interest. So again, I just want to say thank you and congratulations to the systems for making that commitment, and certainly it wouldn't have been done hadn't it been for Mayor Jackson's leadership and insistence that we continue to look for those in our community that may be marginalized or may not have a voice at the table to ensure that their needs are addressed. And really, he challenges us every day that the only way that we know we're doing a good job is if their lives are better because of our work. So again, thank you all for coming, and I guess we can take some questions if you have any.
Before the questions, we have Director Gordon from Health. She is the Director of Health, and the councilman is her chair. So they work closely together, and I imagine there will be some conversation about this at your committee. Yes, sir.
I was going to ask, for those who aren't as familiar with it, could you explain what NOTS is and what is being newly added to it that you're announcing today?
Well, NOTS was an original collaboration between Metro Health and Cleveland Clinic in 2010. And it was a way of trying to coordinate the care of trauma victims within the city of Cleveland and Cuyahoga County in a way to get them to the right level of care. So among those two systems, there was one level one, which is Metro Health Hospital, which has a long tradition of providing outstanding level one service. And we had two level two hospitals within the clinic system at Hillcrest and Fairview on the east and west side, respectively. So we coordinated transports. We transported level one patients, regardless of where they were, directly to Metro Health Hospital if they needed that level of care, and we transported the appropriate patients to level two. With the inclusion of university, it actually, this is, let me describe it as, it's not just a jump up, it's actually a new organization. And I think we need to emphasize that. It brings so much more to the two organizations that were there in the beginning. And now we have two level ones, obviously, with University and Metro Health. We also have another level one, and that's Akron General down in Summit County as part of the Cleveland Clinic system. So there are three level ones. There's one level one pediatric unit, which is Rainbow Babies and Children's Hospital, part of University Hospital, and Metro has a level two. We have two level two adults, which are Fairview and Hillcrest, and we have a variety of level threes, including St. John and some other hospitals within the university system. We will coordinate the care and trauma with all of those systems. And I think we've been asked by the paramedics to develop common protocols that Ed mentioned when he was talking. And that's because they don't want to get confused about, well, if I find somebody who's fallen down or they've fallen 10 feet, which protocol do I follow? And because it'll differ depending on where you're going to take them. The other thing is looking at outcomes. So we've already improved the outcomes in the NOT system that we have. In the new system, we expect that improvement to actually get better yet. And we will share best practices, protocols, and we're going to follow what each of us is doing, and we're going to look at those outcomes.
This may be for a gentleman from Metro. I remember when University Hospitals first announced the trauma center, Metro Health raised some questions about whether this would divide talent among doctors and end up being worse for patients overall. Are those concerns dealt with now and gone?
I don't know that those concerns are gone, but the way to address those concerns is for all three of those systems to come together and to share our experiences and to make sure we're doing the right thing for the people of the city of Cleveland and Cuyahoga County.
Yeah, let me just emphasize this is a new day. It's a collaboration amongst our three health systems for the betterment of the people of the city of Cleveland and Northern Ohio. Regional trauma organizations, NOTS is an RTO, regional trauma organizations are well known to improve outcomes around the country. And in fact, I believe this RTO might be one of the largest around when you start adding up the numbers of trauma centers and the geographic reach of it and the population served.
So first,
I was just going to ask, how has the expansion of an additional level one trauma center at UH affected Metro over the last year, and how many trauma patients did you have in 2015 versus 2016?
Yeah, I don't have those numbers at the tip of my tongue to give you, but we can certainly get you those numbers. Metro Health continues to be a busy trauma center, one of the busiest trauma centers in the country. Our volume has decreased, as you might expect, but we continue to provide excellent care to the patients that we receive every day.
I wonder, for someone who finds himself a patient in this system, someone who's been shot or injured in a car crash, what will they notice about how things are different? How will this affect an individual in that kind of situation?
Well, I think firstly we'll get back to the common protocols and policies. So regardless of where they go, they're going to get very similar types of care that we've all agreed on is the best care that's available. I think the other thing is we won't be overflying or bypassing appropriate trauma centers. So if you're in a mobile ICU and you're a patient who should be treated at University, and maybe you've got a little bit more care at Metro, that stop is probably going to be made at University. We'll work out those protocols, but that's the central theme of what we've been talking about. If you're in a helicopter where it's a minute apart from those institutions, then that won't make any difference. But we'll look at traffic patterns. We'll look at, not that we have weather in Cleveland that might inhibit transporting patients, but occasionally I think that happens. But we'll look at all those things in terms of providing the care, the most appropriate care at the most appropriate center in a timely manner.
Well, I wonder, what was it that it took for university hospitals to become involved in this system? I mean, was there something that changed to bring in UH?
Well, they're a level one trauma center. which just started. Now, we've asked the university to look at policies over the last year or two, and we've actually shared some policies and some recommendations, and it's great that they're formally coming in.
Yes, ma'am.
I was just going to say, I mean, obviously the trauma center, the addition of the level 1 trauma center brought in UH, but it's taken a while from the announcement. It's been almost, it'll be 2 years in May. Why now? Why did it take until now for this to happen?
Putting a trauma center together and making it function well takes time. Level 1 trauma is a big leap and requires a lot of work. And we've recruited some good surgeons, and I think we're ready to move ahead for all the right reasons now.
And also, can you explain a little bit more about why this is a separate organization? Why, obviously it's the addition of UH, but what makes it new?
Well, we formed a new charter, which we've all signed, and we thought that was the best thing to do, is to announce it as a new organization and not simply an addition. But we've been in discussions for maybe 12 months in terms of what this organization would look like, how we would interact together. So we didn't get together last week and decide, hey, let's put together a trauma organization. When Metro and the Cleveland Clinic originally got together, there were all kinds of things to work out and become comfortable with each other. We've spent the last year working pretty well together and talking about what things we would work on and how we would move forward.
When do you anticipate having this concrete plan of which patients go where, and when are you expecting that'll be completed?
So the first board meeting, we had a transition committee which met. It suggested some officers to start the new organization. The first board meeting will be in the next couple of weeks. And then we will take off from there. We'll populate the committees with their chairs and members of all 3 organizations and quickly review the policies that are at university now, the policies which are within the old Knott's organization. We'll homogenize those, and we'll decide how we're going to build the registries and how we're going to look at trauma outcomes, and lots of work to be done.
When do you anticipate you'll have that plan? Any idea?
I think within 90 days, we'll have the basics of it all worked out. I'd like to introduce Jeff Claridge, who's the medical director of Knott's. So we just gave Jeff an assignment.
190 days. 190. No, I think you said 9 days. 9.
Any more questions? Thank you very much. Thank you.